Therapy really sucks. Or at least it feels like that sometimes. As a psychiatrist and a therapist myself, I can definitely relate to people who say they've been to therapy, it's been awful, it didn't help them, it really hurt. But I think we need to have a conversation about this because on the other hand of that discussion, there are people who say that therapy feels great and changed their lives and is wonderful and is the one thing they look forward to every week. So let's have a conversation about what exactly therapy is and why it can feel like either one of those things, depending on what's going on at the time. In my opinion, a skilled therapist knows when to cheer you on. They know when you just need a little bit of support, when you just need someone to be present with their suffering and listen. And it can feel remarkably good, especially when the person you're working with is in a situation where they have nobody else who's able to provide that for them. Now, on the other side of that, therapy is supposed to help people grow and change the way that they experience their lives. And if we know anything about change, it's that the engine of change is often discomfort, which is why a skilled therapist also knows when to push. They know when to challenge you. And depending on the work that you're doing at the time with your therapist, they may be leaning in one direction or the other. Most effective courses of therapy therefore require a tremendous amount of trust and therapeutic rapport between the patient and the therapist, because the therapist has to really deeply understand the values and the goals of the patient that they're working with. The patient has to understand that the therapist really actually gets them. They have to believe that, and it takes a lot of work and relationship building in order for patients who oftentimes have plenty of reason to be distrustful of therapists or people in general to really internalize that sense that this therapist has my best interests at heart. So when the therapist leans in the direction of support, it actually lands, and the person believes that, oh, the therapist actually genuinely believes these positive things that they're saying about me. And when the therapist leans in the other direction and pushes a bit and challenges and questions the person's beliefs, the patient understands that they're not being invalidated, they're not being gaslit, but rather somebody that they trust is pushing them in a way that they want to be pushed. There needs to be enough reserve in that therapeutic relationship for allow you to spend those tokens to push, to grow. I'd like to invite you to take this opportunity to create a space on this post where people can see that both things can be true about therapy. Because oftentimes the feedback people get is very polarizing and often puts people off from trying therapy, which I've seen really change people's lives, both as a provider of therapy and as a patient of therapy myself. If you're willing, please share your experience in the comments. Your story might be the inspiration someone needs to get the help that they deserve.